Hi everyone, welcome back to your channel I Love Pharmacology. In this session, let us learn about the one of the very important antimicrobial agent, that is tetracyclines. Myself Dr. Padmanabha TS, Faculty of Pharmacology. So first thing you should remember is with respect to tetracyclines, tetracyclines are teratogenic in nature. Please remember T for T. So tetra is teratogenic in nature. Why means if it is administered during pregnancy, it can affect the teeth of the child, as well as it can decrease the growth of the longer bones, means the tall bones growth can be retarded in the fetus. So basically it will going to damage the teeth, leading to discoloration of the teeth, as well as it will going to affect the tall bones and inhibit the growth of the bone. So basically it will going to affect the fetus. Also, if it is given in children also it will going to affect the teeth as well as the tall bone. Both it will going to cause deciduous teeth, discoloration, as well as it will going to cause retardation in the bone growth. So because of this, the child may have a short stature. So apart from that, you should also remember tetracycline are bacteriostatic in nature. Bacteriostatic in nature. So what is the mechanism of action of tetracycline? So the mechanism is T for T again. T for, you can remember it as 30. So it binds to the 30S ribosomal unit. It binds to the 30S ribosomal unit on the mRNA, and basically it inhibits the protein synthesis. How? It will going to prevent the attachment of the amino acid tRNA to the mRNA. Thereby, it inhibits the protein synthesis process. So please remember tetracycline T for T, it will going to bind to the 30S ribosomal unit and inhibit the protein synthesis by preventing the attachment of the amino acid tRNA to the mRNA. So next, coming to the what are the tetracyclines we should know. So we have a tetracycline, doxycycline and minocyclines. Since they are broad spectrum antimicrobial agent, so please remember tetracyclines are bacteriostatic as well as they have broad spectrum of activity. They can cause super infection. There can be a chance of increased risk of membranous colitis, pseudomembranous colitis. So that is one of the super infections. So how do you treat super infection? By giving the metronidazole or the vancomycin. So coming to the some of the pharmacokinetic parameters. So most of the tetracyclines will be eliminated by renal route. So the dose has to be reduced in case of renal failure or renal insufficiency. And there is one drug, that is doxycycline, which will be passed through the fecal elimination. So doxycycline, D for D, doxycycline gets defecated through the fecal elimination, and it is preferred in case of the renal failure. And so what are the uses? So uses, it you can remember it as M bar. They are effective against gram positive as well as gram negative cocci. They are also effective against gram negative microorganisms. They are also effective against the anaerobic infections. They are also effective against the rickets, listeria, etc. So it can be remembered as MBARC. M stands for Mycoplasma pneumonia, B stands for Borrelia burgdorferi, R stands for Rickettsia, A stands for Propionibacterium acne, and one more C stands for Chlamydia, and one more C stands for the MRSA, community acquired MRSA infection. That is, doxycycline is effective against the MRSA infections also, that is methicillin resistant staphylococcus infections. So apart from that, you would also remember it should not be combined with some of the things. So tetracycline, since it will going to chelate the calcium, it should not be combined, because when it gets chelated with the calcium, it forms a insoluble compounds or insoluble complexes. So tetracycline should not be combined with milk, antacids and oral iron because it forms a divalent cation, thereby it prevents the absorption because of their non-absorbable compounds. And what will be the side effects? So as we discussed, it is contraindicated in pregnancy as well as child because it will going to affect the teeth and the tall bones. So exception for this is the doxycycline. And apart from that, how does this tetracycline will going to develop a resistance? The most important mechanism of development of resistance of tetracycline is by decreasing the uptake of tetracycline into the microorganisms, basically by altering the porins as well as by increasing the efflux of the drug from the bacteria. So apart from that, what are the side effects? So we discussed the side effects of superinfection. It can cause superinfection. Apart from that, very most common uh, side effects that can be encountered with tetracycline is whenever the cycle is taken to sun for a ride, it causes photosensitivity reaction. Most commonly, it can cause photosensitivity reaction. So apart from that, even the minocycline can cause vestibular toxicity specifically. So it can cause ringing of ear, ataxia, etc. So whenever there is a use of expired tetracycline, it can cause Fanconi syndrome. Basically, it will going to cause acute tubular necrosis. Whenever you use the expired drug, the expired tetracycline can cause Fanconi syndrome. And apart from that, demiclocycline is also a type of tetracycline. This demiclocycline has got anti-ADH action, anti-diuretic hormone action. Thereby, it can cause diabetes insipidus-like condition. Apart from that, this tetracycline will also going to damage the liver. So you should be very careful when you are using tetracycline in case of pregnancy. It can cause acute hepatitis. And also it has got anti-anabolic effect. It breaks down the proteins. So anti-anabolic effect. So what are the side effects that can be encountered with tetracycline? It can cause photosensitivity reaction, super infection because of their broad spectrum of activity, vestibular toxicity due to minocycline, Fanconi syndrome in case of expired tetracycline usage, and diabetes insipidus in case of the demiclocycline. And also tetracycline can cause liver damage and the anti-anabolic effect. So one of the synthetic form of tetracycline is a tetracycline. So please remember tetracycline. So tetracycline is a newer form of tetracycline. They belong to glycyl cyclines. So basically they are effective against the MRSA, VRSA, Enterobacter as well as the anaerobic organisms as well as the organisms which are resistant to the tetracyclines. So where we can use tetracycline, it can be used in community acquired pneumonias, intra-abdominal infections as well as the skin structure infections. So what are the common, to summarize, what are the things you should remember and under the tetracyclines? So please remember tetracyclines, you need to remember T for T. All they'll start with T. So they're teratogenic in nature. They are acts on 30S ribosomal unit. They inhibit the protein synthesis. They're bacteriostatic in nature. And basically it will going to affect two things. One is the teeth and the tall bones. So it can cause super infection because of the broad spectrum of activity. Minocycline specifically, it can cause vestibular toxicity. So expired drug usage can cause Fanconi syndrome with which antimicrobial agent? Again tetracycline. So which among the tetracycline will going to cause the diabetes insipidus as a side effect? That is the demiclocycline. And this tetracycline cannot be combined with this milk antacid as well as oral iron because it will form a divalent cation because of their chelating property and it will prevent the absorption. So they are contraindicated in pregnancy and child because of their teeth and tall bone adverse effects. Exception is doxycycline. So apart from that, it can also cause liver damage as well as the anti-anabolic effect. And one should not remember whenever the patient or on tetracycline or exposed to the sun, it can cause photosensitivity reaction. And this tetracycline are not effective against the MRSA, but there is a tetracycline which are effective against the MRSA, VRSA as well as the anaerobic organisms. So this was all about the tetracycline antimicrobial agent. If you find this video useful, please do subscribe to my channel, I Love Pharmacology, and do not forget to hit the like button as well as the share among your colleagues. Thank you.